got it. Good afternoon. Today is September 23rd, 2024, and it is 12:05. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Ad Hoc Appointments Committee. As a reminder, some of our committee members may also be participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. Also, I want to note our chair of the Board of Managers and Kitchen has temporarily appointed Manager Brinson to this committee in order to make a quorum for today. Thank you and welcome, Manager Brinson. The first item of business is public communication. Members of the public who wish to make comments virtually during the public communications portion of the meeting must have registered with Central Health via the online form or by telephone no later than 10:30 a.m. today. Yesenia, did anyone register to make comments for the Ad Hoc Appointments Committee meeting?
We do not have anyone signed up to speak.
Thank you. We'll now proceed to the committee agenda. The first order of business today is to approve the minutes of the Ad Hoc Appointments Committee from November 6, 2023. Can I have a motion to approve the minutes? I have a motion and a second by Manager Zamora. All approve? Aye. Okay. Thank you. Agenda item number 2, discuss and take appropriate action on the appointment of Ms. Molly Hahn, Mr. Juan Garza, and Mr. Gerald McDonald to the Sendero Health Plans Board of Directors. Regarding the next items, these were created last year by the Ad Hoc Appointments Committee and is providing your backup. I'd like to note that we've included a series of questions that were generated last year. We do not need to adhere to this set of questions, but I'd like to act that those may be our guardrails for this. This hopefully be more of a dialogue. Okay, so, alrighty. Mr. McDonald? Welcome, good afternoon.
Thank you.
And thank you for your work with Sendero. We greatly appreciate it.
Yes, thank you for the opportunity.
Would you like to have an opening statement, or do you want us just to proceed with some questions for you? And
I do have an opening statement, and then I would love to entertain any questions that you have.
Thank you.
I thought it would be good to just give you a little bit of background on myself and then what we've been working on at Sendero and some of those focal areas that I've been able to assist with. I've been in healthcare for just about 20 years. I'm a former hospital administrator turned technologist and am currently the CEO of Omaven Health, which is a company that specializes in AI for healthcare operations. So healthcare has always been a very important thing to me, especially as a person that experiences many communities, right? I think that one of the things that I did want to talk about first was my experience thus far. I've had a great experience working on the board of Sendero. I first wanted to thank you all for the opportunity and the support that y'all have provided to Sendero because the work that happens at Sendero really does provide that access to care that's so needed, right? But without you giving us that permission to keep on learning and experimenting, that wouldn't be possible. I would like to thank the chairs of Sendero's board that I've interfaced with, both Betty and Juan, for their leadership, being able to learn from them and continue to work with them. And then, of course, the CEOs that I've experienced during my tenure, which is going to be both Perla and then also Sharon. I think that they've both done a tremendous job, and I think that one thing I wanted to emphasize is that as a person who identifies as a change agent, a potential agent, they've all been welcome and receptive to that. What are some of the things that we've been working on? The go-to-market strategy, understanding how to actually find members, maintain their satisfaction, make sure that they get the care that they need. Those things will, of course, continue. We've worked on solidifying the infrastructure of the organization through many different ways. And then the two things that I think are probably going to really be focal points going forward and always have been, which are going to be the operational rigor and then also equity in all forms of that term to make sure that we are addressing everyone's unique needs. Where I think that there is room for improvement, and this is just always room for improvement, is that we can always work together better as boards or across the enterprise. We have so much talent and so much potential. I think that that's what we just have to harvest and really figure out how can we combine those talents. We need to work on measuring our value, both quantitatively and also qualitatively, right? Because inevitably we want to be able to show value both to the citizens and to everyone involved here. And then we want to make sure that we're creating efficiencies through applied AI. I think you can see why I see the opportunities for that. Some general thoughts and questions that I think we should all keep in mind are, how can we make the work at Sendero better support the greater strategy of the enterprise, is number one. Number two is, how will we show evidence of our improvements, both around equity and then also the return on the investment. Number three is, how are we as members of the various boards informing the enterprise's North Star to adopt emerging tech? And then I think the fourth one is the biggest one, which is around our legacy. What contributions and advancements do we want to put in place that will become normalized and lay the foundation for both the future of Central Health and the safety nets as a segment? I'll take any questions.
Thank you very much. Andrew Brinson. Anyone?
Thank you very much, and thank you for being on the Sendero board. We know there's been probably some long meetings and long nights over the past 2 years or so. So you are a co-founder and CEO of Omaven Health?
Omaven, yes.
Omaven Health?
Yes.
Can you tell us a little bit about that? Just
Sure. We started the company in 2018. It is essentially an answer to an observation that we had in the market, where oftentimes in healthcare, there will not be enough people to power healthcare and actually meet people's needs. And so we started finding ways, how could we take away some of those repetitive or manual tasks, give those essentially to a robot to do, and so humans can actually work at the top of their license. We work with clients all over the nation, and it's been a phenomenal experience just taking that knowledge that I had and had already proven as a healthcare administrator and using some of this technology before, packaging it up so it's scalable and works for everybody.
wow, amazing. Well, that was my only question. Thank you.
Sure.
Anyone else? Manager Valdez.
Okay, thank you for your service. Thank you for helping at Sendero. So you were with you all began Omega in 2018, and you came on to the Sendero board in 2019.
I believe it was 2022,
Oh,
but I
okay,
could be mistaken.
much sooner.
Yeah.
How would you say that we could further your mission or help Sendero do a better job as Central Health and as a board of managers? Are there any ideas that you may want to throw at us?
I have a long list. I don't know if
Well,
you want to go there.
give me a
Just a few.
No, so I think that even more than speaking.
prioritized list.
Sure. I can give you one or two specifics, but I think more importantly, it's around asking different questions, right? I think that
Such as?
there's two ways that I see that AI gets approached. One is where people look for efficiencies. Think about that as Sears. Sears was an organization that was able to create a better value chain, create efficiencies, but Sears is no longer Sears. Amazon, on the other hand, looked at AI as an operating system that allowed them to reevaluate every single process and every single goal that they had, and that's how they were able to deliver better care. We all know which one made it and which one didn't. And I think that asking, how do we reimagine how work is done, is the only question that you have to ask, and ask it continuously, right? Because inevitably, times are changing, but many of the things that we've already been doing have room for improvement. I think this is even UT is calling this the year of AI. The reason why is because this is one of those lifetime opportunities to rethink how we do everything. How can we do it better? How can we reach more people? How can we do it more cost effectively? And one of the questions I love to ask is, should a person even be doing that thing, right? Because oftentimes we just piled on layers and layers of things that people have to do that takes them away from the heart and soul of being a human in their interactions.
Just to follow up real quickly, so in the AI world and in the human world, Sendero has built its reputation on the humanness
Sure.
of its staff that interfaces with the members
Right.
or potential members, and addresses their needs. How do you really think that AI is going to be capable of doing that to a great extent? That's just basically it.
I understand the question. I would slightly pivot it from my response in that it's not AI against human or human against AI. It's human and AI.
Well-
That's the equation for the future, without a doubt.
Well, I
have-
didn't mean
Right.
substitute. I just wanted to know what you were
Right.
going to tell me.
Well, no. So
thank you.
That's laying the foundation for. That's exactly what Sendero must do. Look at how we can actually amplify the good works of the humans by using technology that actually serves them, rather than oftentimes technology makes you serve it. Think about all the clicking that has to happen. Think about all the different tasks that have to happen just to document. We can make it easier for that person and therefore allowing that person to have more capacity to have human interactions and to actually get to know that person's real needs.
Thank you very much.
Sure.
No questions for me. I got a chance last time to meet Gerald, and I was very impressed.
Gerald, thank you. I do have a couple of questions, and they're sort of vague, but they intertwine. What do you see as the primary role of Sendero's relationship with Central Health?
I view the first role as making sure that anyone that is in need of care has an organization that actually allows them to access care, right? I think that Sendero obviously is an independent organization, but its job is to support the mission of Central Health, which is to provide health care for all in the county, et cetera. I think that we've done a good job of that, but in order to continue to serve that role, we'll obviously continue to iterate to find out what are the new needs, what are the new ways we can support the Central Health mission, and actually really tapping back into the community to say, you set the level here, we met that, what's the next thing that you need? Because that's inevitably our job.
Okay, thank you. I guess you've alluded to this, sort of, what efficiencies do you see that could improve Sendero's health in terms of enrollment and delivery of care? You mentioned checking for efficiencies and
Sure.
whatnot, which is we have to compete, or Sendero has to compete. What do you see as things that might change at Sendero that would improve efficiencies of delivery of care and of enrollment, et cetera?
Sure. I would say that, one of the key metrics that we have to make sure that we're always looking after is how well are we serving the individual need of one, right? So N equals one. In order to know exactly what Gerald needs versus anybody else needs, we have to have a pretty robust staffing structure, because how else could one person or 20 people be able to tap into everybody's unique needs? That's where AI is a very good tool, right? Where it's able to be the person that is communicating with people 24/7 in their language at their convenience. And I emphasize that at their convenience because if we zoom in on the story of one person, let's say that person works 2 jobs, day shift, night shift. It's very hard to be able to make phone calls to get what they need in between jobs or on their break. Being able to text that takes it one level higher. Being able to do that 24/7 takes it another level higher, as well as you create that cost efficiency of being able to scale the delivery, right? Because for those easy tasks, AI would do it. For those more complicated things, it would escalate it for one of the folks that Ms. Valadez was mentioning before, right? Because we want to make sure that we're always using the technology to better serve or amplify human potential.
Do you feel the Sendero board is open to those changes or geared towards those changes at the moment? Do you feel?
I believe the board is open, but I do believe that, just from my perspective, as a former consultant, it's not a one-time thing, right? It's not just even about Sendero. It's about us looking at ourselves, all of us, both Central Health Board, Sendero's board, and every single piece of the enterprise, and make sure that we're holding ourselves accountable to asking that same question I mentioned before. How do we reimagine what can be done? And as long as we continue to do that, then we are on the right path to move forward and continue to grow.
I have one question, perhaps the most important one to me is, do you feel the Sendero board feels listened to by Central Health, that y'all have our ear?
First, I will say that I think that it was a very strategic and very smart strategy to make sure that we have members shared between the boards. That ensures that we stay in alignment. But there's always room for opportunity to increase our communication, make sure that we're all aligned. I can say for myself personally, I do feel listened to, but I do think that as we're talking about this moment of potential, this moment of change, we should relook at how many touch points are we having, what are the measures that we want to talk about, and essentially, I love that you're even asking that question. How can you better support the work that we're doing? Like, that is the ongoing question I think that will continue to make us grow.
That's it. Thank you. Anyone? Oh, yes. Any other questions? Elisa, could you hear me?
No, I'm
Okay.
good, thank you.
Okay. Then thank you so much for coming. We greatly appreciate your work.
Thank you very much.
Thank you. Or any of the other? Okay, that's fine.
We're gonna talk to all three of them, right?
Yeah. Let's see, were you recommending going into closed session later? No.
We can pause if we have to take a couple of extended times.
Oh, there she is, she just logged in.
Okay, never mind.
Okay.
She logged into the thing. Okay. We can call her up. I see her, on the Zoom call. Okay. Her name popped up, yeah. Okay. There she is.
Hello.
Hi, Mrs. Hahn. Welcome.
Hi.
Okay. Well, thank you for coming to talk to us. We'd like to begin by asking you if you have any sort of opening statement or comments you'd like to preface before we begin.
No, this is a little earlier than anticipated, I think, because our actual board service started 1/1 and rather than 10/1. So it's been a little bit of a quicker turnaround, but excited to be here and talking with you and at such a really exciting point in the Sendero journey after the last almost 2 years, just short of 2 years. So.
Thank you. Well, I'd like to open the floor. I mentioned earlier that this is more of a dialogue than a interview. And I'd like to open the floor now for any managers to ask questions. Anybody? Well, I have one. How long have you been on the Sendero board now?
So not quite 2 years. I think the board period actually started 1/1 rather than 10/1/2022. I think there was just a little bit of a delay in getting kind of the replacements appointed as there was some folks rolling off. And then Gerald and I both started as of 1/1/2023. So a year and 10 months.
Okay. Anyone?
So over this period of time with Sendero, it's been, I'm sure, a challenging time. And what was your favorite thing about the challenges that you had to meet?
Yeah, it has been, as exactly as you say, a time of a lot of change and both external forces and kind of the impact on that, and also internal to Sendero, leadership change and kind of vision shift a bit. It's hard to think of anything right now besides sort of being able to see a lot of those conversations really come to fruition during this open enrollment period that we just went through. You know, a year ago, we really knew that there needed to be a significant change in sort of the membership numbers for Sendero, and that was going to really be the defining factor of the ability to kind of manage and control the Sendero kind of budget and functions. And a lot of time and effort was put into that, both by Sharon under the new leadership and a lot of the team at Sendero internally, and to be able to kind of be a part of those conversations and hear all of that strategy and planning, and then actually kind of come back to those meetings and see those share outs and see those numbers where we hoped that they would be, but certainly had no guarantee that they would be, and see those kind of metrics met based on all of that really deep planning was a very gratifying experience, and really very optimistic and encouraging experience over the last few months. So that's very top of mind because it is so recent, and also such a big win for the organization. So I've really enjoyed being a part of that.
And as a team, how do you guys work together?
On the board?
Yeah, on the board.
Yeah, Sendero, I came from the nonprofit world and worked with a lot of boards, and Sendero has got a really interesting board because it's a very tight-knit board, I would say. There are a lot of experts in the room and a lot of really great perspectives. And so much of it is done kind of in group setting, which I think previous experience and with other boards can be a little overwhelming to do so much as kind of a whole board. But I think it's really successful in my experience with the Sendero board. So for example, a lot of the financial discussions are held as kind of a larger board, because the committee is actually the whole board. There are some kind of smaller committees. So the HR committee, which I'm on, for example, where we really met a lot during the CEO interviewing process, is I think 4 members of the board. But I think in general, the board is really thoughtful about who it makes sense to have kind of be a part of conversations. And when there are those sort of larger financial conversations, especially this past year, it has been kind of an all hands on deck. Everybody really wants to get into the numbers and be aware of kind of what's happening, and all of these discussions around sort of the Central Health partnership deepening, and really being a part of that. So very collaboratively and very close together. And I think this past 2 years, it has been probably more so even than it has been previously, because as you know, we've mentioned, there was a lot of change happening the last 2 years in terms of the leadership change for the organization. So I think I've really enjoyed working on the HR committee and being a part of the interview process, which was one of the smaller groups, because it was a really great way to work really closely with Juan and Gerald and the other folks on there, but also have learned so much from those larger committees where we do have kind of the expertise of the bigger group at play there. So a little bit different depending on kind of what the subject is, I guess I would say, in terms of how the kind of the board works together and addresses different topics.
Well, thank you very much, and thank you for all your work on the committee. Thank you.
A pleasure.
Thank you for your service, Molly. Since the majority of the board are Central Health staff members, so they have the Central Health agenda, and then there's Sendero, which is they both are supporting each other because they're all part of the enterprise. But do you see that as a hindrance or a benefit to the Sendero board that it's made up of Central Health staff working on a separate corporation for all intents and purposes, but all for the benefit of the member and then the population that we serve or are targeted to serve? Because your membership is going to be a little bit different than who we serve. And that is going to be, our targeted population is those that make less than 200% FPL, but.
Yeah, and I mean, there's quite a number of us that aren't Central Health employees. I'm trying to think off the top of my head, like Gerald and Betty and quite a few. Yeah, I think that's been a really interesting element to have that mix, especially with sort of the expertise that the folks who are sort of overlap people bring in terms of what's going on with Central Health and sort of the vision for the overarching organization. Obviously, we've also gone through this whole rebranding process quite recently with Central Health and Sendero and the other entities that has really focused on sort of aligning the public understanding of the agencies and really the mission and vision to support the people of the area with healthcare. So I think a lot of what was really successful during that time of transition was sort of relying on the expertise of the Central Health folks. So Perla, was the interim CEO and just had such an incredible amount of understanding of the community and the people who, were in need of service. And obviously Sendero has some different folks, but we really are so aligned in terms of that mission of serving folks, and especially with the CHAP expansion kind of in the Sendero population that is involved with that. There is quite a bit of population served that is overlapping for sure, and sort of leveraging the unique position that Sendero has in the world as an insurance provider, and the ability to tie into sort of the risk adjustment and all of these various tools that are very restricted to kind of insurance providers, and leverage those to really benefit the organization overall, and to expand both who Sendero can serve, but also, grow that CHAP expansion population as well. And those are the hardest people to, support their health outcomes, the people who need it the most. And it doesn't, it's not an easy fix to really support the people most in need of healthcare in our community. And I think the alignment of Central Health and Sendero is a really exciting tool to think about how we can kind of leverage some of the insurance marketplace tools that are out there to support those people that are most in need in our community, that Central Health is just so incredibly aware of and constantly, supporting, and kind of bringing those opportunities into alignment with the Sendero kind of unique position has been, I think, a really important element in the overall mission of the organization.
Thank you. I had just one more question. Since you all serve people outside the Travis County boundaries, do you think that there can be any opportunities or expanded opportunities to bring more people in, since we do have, I guess, a gentrifying effort going on in Travis County. So poorer people are being moved out to other other counties. And you all are serving by providing membership and services in those counties. Do you believe that there is something else that could be done in order to enhance Sendero's position in those outside of Travis County?
Yeah, I think, when we talk about alignment with Central Health, obviously we talk a lot about helping like the CHAP expansion and these people who are sort of these unique, this unique part of the marketplace who needs care. But Sendero is a really good insurance provider, a really high quality insurance provider. And that is a huge resource to any community. And while we don't have we do have kind of the majority of our folks in Travis County. We do, have quite a number of folks that we service outside of Travis County and have those relationships because that is a big part of the Sendero kind of experience, is really high touch points and really high quality care and relationships with customers, clients, folks that maybe aren't kind of who Sendero or who Central Health has dealt with, but who have found us in the marketplace and have really found a great home for their health coverage. So I think that's an interesting future discussion around sort of the Sendero profile outside of Travis County and how we are already sort of in the communities to some degree, maybe more with a lot more kind of folks who are kind of marketplace customers, but how we kind of can leverage those relationships and see how we can even better align with Central Health and a lot of the things that Central Health is working on in terms of expanding your services to be more geared towards the future of Travis County as opposed to necessarily what has existed in the past. So looking forward to it for sure, moving forward with the alignment with Central Health.
No questions, just a remark, Ms. Hahn. Thank you for your service. Thank you for your dedication. Certainly thank you for that message you just gave us about it's about the patients. And our board here has heard me say that for the last 12 years. If I'm fortunate enough to be reappointed for next year, for another 4 years, great. I will continue to advocate for Sendero. You aren't around yet, but my first year as chairman of the board here, the board actually chose not to continue with Sendero, and it was my manager next to me, Manager Valdez, and we went back and we rethought those thoughts, and we continued the services that Sendero was having. So the board wasn't happy with me, but I did it. I was the black sheep then. But if I'm not on the board next year, if the county commissioners don't choose to reappoint me, I would certainly love you and your board to come remind the board here that we're serving the public. We're doing God's work to take care of our patients. The perfect example was at our meeting on a month ago at the Central Health anniversary, 20-year anniversary. The young lady who sang to us was a HAM member, and that's how she gets her health insurance through you guys. So thank you for your service. Thank you for those remarks. Continue to preach that you guys are doing the Lord's work. No questions.
I have 2 questions. What area of expertise do you feel might be missing on the board if we're looking at a new appointment? What area do you think might be a deficiency? What should we look for in a future board member for Sendero?
That's a really interesting question. I think one of the tricky parts about the Sendero board is it is a really, and I have certainly learned this. I've worked in Medicaid for many, many years, and you know, sort of the insurance world is such an interesting and different kind of can of worms. And I think that there is so much expertise right now in sort of the intricacies of the insurance marketplace and the regulation world and how all of that kind of plays into one another. I know when we were talking about kind of the CEO hunt and what, you know, the organization really would benefit from, we did have a lot of conversations around sort of trying to think about a really strong like medical background versus an insurance knowledge, a really deep insurance knowledge base. And we're so lucky and enthusiastic about the incredible amount of expertise that Sharon brought to the table in terms of an insurance depth of insurance knowledge that is just really, really incredible. But I think kind of the flip side of that, which is interesting, is sort of the medical expertise and the population health expertise. Certainly, you know, I think mentioning up front, we've grown so much this past year in terms of membership and being able to really align with the unraveling of the public health emergency and people, you know, losing their Medicaid coverage and being able to provide coverage. And I think as we grow as an entity and we cover more people, I think that sort of population health view is really interesting and a really important part of the vision setting moving forward, and would be a field of expertise that I would think would be a really big contribution to the Sendero board.
I have one last question, and it's the same question I asked of Gerald, and that is, do you feel the Sendero board feels listened to by Central Health's board?
Yeah, so Gerald already went, good to know. Yeah, no, and I think that has been something that's been really a requirement of, but also a sort of bellwether of, or a guiding light of the past year and a half, as Sendero has really had a lot of challenges and has had a lot of push to plan for the future and think about things a little bit differently and strategize much more intensely. I think that has been something that has kept us sort of on track, is knowing that the Central Health Board is really intently interested and in the future of Sendero and the ability of Sendero to continue to serve people and provide that, and also really expecting share outs and updates and you know, status on all of these kind of goals we're putting in place and plans we're putting in place. And that is always kind of in the Sendero board meetings a big topic of, you know, what is the we've talked about sort of internally now all of the updates and the status of these kind of strategic plans we've put in place. And there is going to be this share out to, you know, the Sendero or the Central Health Board on this date, and, you know, who can come and would like to, you know, represent Sendero and be a part of that. And unfortunately, it hasn't worked out for me schedule wise, but I know like Gerald has come before. Amit and some of the other folks who have some overlap, obviously, as well. And I think that alignment has been very clear and very obvious, and the interest from the Central Health Board in the feedback from the Sendero board, I think, is very keenly felt.
Thank you very much. Manager May, any questions? Okay, well, that's all then. Thank you so much, Ms. Hahn. We appreciate your service and time. Thank you.
Thank you so much for your time today. Take care,
Thank you.
everyone.
Moving on, I see that Mr. Garza is on. Hello.
Hola, Juan. I don't think you can hear us.
There you go, sorry.
Okay. Welcome. and thank you for attending today's meeting.
You bet.
So, we've been starting this off by letting any of y'all, if you have an opening statement or comments you wish to make before we proceed to questions. And this is more of a dialogue rather than an interview Q&A. So if you have anything you'd like to say before we start, we'd appreciate it.
I guess that the one opening remark I would make is that I've been associated with Central Health and Sendero now for actually over 10 years. It has been my sense from the beginning that Sendero exists to help Central Health achieve its mission. If it's not achieving its mission because something that Sendero is doing, we need to fix it. It does not exist for any other reason. It has to help Central Health achieve its mission. It needs to be aligned with Central Health, and whatever service it can provide that can be melded into what Central Health does needs to be done. I think we're accomplishing that recently, and I'm very pleased with the progress we've made in that regard.
Thank you. That's very reassuring to hear. I'd like to open the floor to anybody who has questions. Manager Brunson.
Thank you very much, and thank you for serving on the Sendero board for so long, and of course your involvement with Central Health also for so long. And I do think that that your knowledge, your deep knowledge of Central Health, and now your position on the Sendero board is probably of a great service to Central Health, because you do probably help guide the hopes of the Central Health Board to the Sendero Board on the alignment being so important for us. In what ways do you feel that Central Health could improve things for Sendero financially, but also just as a better way for the two groups to communicate?
Well, one major way, well, a couple, but first of all, just to have the Central Health staff consider Sendero part of their staff. It's very, very important that they work really well collaboratively together. But beyond that, there are some things that practically work well for Sendero as well for Central Health, and in fact all the entities. For example, Sendero will be doing the claims administration for itself and also on a contractual basis with Central Health. It can do the entire enterprise, and by providing simply market value, the Central Health will be paying Sendero a price for its services that it renders to Central Health. Again, a market value, and I think it would lessen the reliance that Sendero has on at times additional financial support from Central Health. The way I see it, we can pay the fair market price or pay something lower. At the end of the day, if we pay the lower price and Sendero winds up seeing a deficit, probably will be over or underwritten by Central Health. One way or the other, the two work together. Different accreditations could be done through the Sendero staff. Instead of having three entities doing the same thing, probably paying 3 times the amount, you could do it just once. Anytime you can see any overlapping areas where the same need is required by all three entities, we should only do it through one entity. It could be Sendero, it could be Central Health, doesn't matter, as long as it's just one entity doing for example, the credentialing. Things like that I think could help the entire enterprise operate much more cost effectively.
So your idea is to improve the efficiency of the organization by having like an overseeing, like everyone sharing in the same structure.
Right. There's no need to pay for anything twice. Once is enough.
That's great.
Manager Valadez.
Hola Juan, ¿cómo estás?
Muy bien. How are you?
Okay, so because Sendero addresses or has members of Sendero in counties outside of Travis, and they are receiving the outcasts, the people that have been run out of Travis County due to affordability. Are there any things that, any things that you see that might need to be changed in order to better accommodate or reach out into those different communities to increase the membership? And is there anything that we can do to help Sendero reach into those communities? Because we're only concentrated in Travis County, but we do know that there are increasing numbers of poor people outside of Travis County. So what do you think?
And the surrounding counties don't have the resources that Travis County has to provide for those of us who need our help. I understand that. It is that my sense that what Sendero can do is to remain as affordable as we can. And we try to be very competitive with the rest of the market. Unfortunately, the way it works is all of the insurance markets are dealing with the same providers. So the only way that you can lower those prices is by having really, really large populations that you serve. We don't have that large of a population, so it makes it more difficult for us to be competitive. But our rates have been competitive. Ever since we appointed Sharon, she has gone through and restructured the staff, made it much more efficient and saved us a bunch of money. Just in one instance involving our software systems, she saved us like $800,000 in one fell swoop, which is for us tremendous. And it's interesting because every one of the contracts that we entered into, we very carefully advertised and let them according to competitive processes. So we felt we were getting a very good deal to begin with, but she found us a better deal. And then the staff that is being brought to bear internally are all pretty much experts in the insurance business. So that's something we could do, Ms. Valdez, to make it more accessible. Reaching out outside the county lines for us is problematic because of just the fact that Travis County operates within Travis County. And for example, when we discussed the requirement that our service area has to be broader than just Travis County, there was considerable debate at the Commissioner's Court, as I recall, over the fact that we might be spending Travis County dollars outside of the county. So it's always problematic. We always want to help as many folks as we can because really there is no artificial boundaries to the needs that people have.
Thank you, Juan.
No question.
Manager May, any questions? Okay, thank you. Mr. Garza, first, thank you for all your work you've done with Sendero. I really appreciate it. I had a question that I asked Manager Han, and I have it for you too. What area of expertise do you feel is lacking on the Sendero board? If we needed to appoint someone, what should we be looking for that y'all's needs are?
I have to tell you, I really, really, really have valued the service that Betty Dillard brought to the board. Now she's no longer going to be a member, but someone like Betty brings a whole world of skilled knowledge to us. These are folks that she can immediately see the advantage or disadvantage of any product that we might have because of her knowledge of the way the system works. So it's very, very important to have those kinds of folks on our board. They're difficult to find, of course, but someone along with those credentials would be of tremendous assistance to all of us.
Okay, thank you. As chair of the board of Sendero, do you feel you have a direct line of communication with Central Health's board, CEO?
I've never felt in any way impeded. I have quick access either to Mike before Patrick. Both of them are always take my calls. I feel like I can call any member of the board of directors, or board of managers, I should say. I hesitate to do that because I do try to work with the chief executive as much as I can. I just think it's more appropriate to do it, work in that way. But I've never felt that in any way impeded in speaking with any of you. It's just something that I've always attempted to work things out with the staff if I can.
Okay, thank you very much. I have no more questions. Anyone else? No. Well, thank you so much, Mr. Garza. We really appreciate your time and your work. It's very important. Thank you.
Okay. Thank you for allowing me. It's a real privilege.
Okay, thank you.
Thank you.
All right. Any further comments, questions? Anyone? No? Okay. I'd like then to ask for a motion. Yes? Manager Valadez?
I don't know where the motion sheet is, but I'd like to move that 3 appointees to the Sendero Board be reappointed.
Second? Second? Yays? Yay? Nays? Did you vote yay?
Yes, sir.
Okay. Thank you so much. Okay, so the motion so passes. Thank you. Okay?
Deep in thought.
Alrighty. Next agenda item is discuss and take appropriate action on the appointment of Mr. Hal Katz and Dr. Weatherby Zamora to the Integral Care Board of Directors. Mr. Hal Katz is not available today, and we'll be arranging some type of meeting with him as soon as possible. So, Dr. Zamora is up.
Over there, he was there.
That's where you get grilled. Okay. No, here's fine. Okay. All right. Well, Manager Zamora, do you have any opening comments about Integral Care and our board and before we start?
Well, I think the relationship we have with Central Health and Integral Care is important because we do provide the funding that they need to continue to do the Lord's work. You know, many of our homeless patients have brain health, and you know that, Joe and Cynthia. You know that they're doing great work over at Integral Care. At my planning operations, my P&O committee that I chair over at Integral Care, I tell the staff that they are the shining example of how we should do brain health. You know, I go around the country going to different meetings and we talk about brain health and how everybody's lacking in their, whatever you want to call it, Integral Care, MHMR, whatever. And I brag on our team here because they really do a remarkable job. As we all know at this board, you know, the penal system is the biggest provider of brain health, and our MCOT team tries to keep our homeless people from having to go and get arrested and get to sent to jail. You know, they're just doing an incredible job. I've been on the board since I think 2014, I believe. And I would like to continue to serve because it's the right thing to do. We need to continue to serve those patients who just need a little help. So I would be honored if you reappointed me. I would love to be there. They do great work. Thank you.
Dr. Zamora, I worry. I really, really worry about sometimes the morale of those staff people at Integral Care who have the hands-on intersection with the population that they serve. You know, I see that in Gloria's case managers. She may have changed case managers 4 times within a year because they keep leaving. They come in, they're here for a few months and they leave. They come back, they come in, they don't have enough time. The people who are the frontliners don't have enough time to make a good relationship with their patients. And I seriously believe that a lot of that has to do with money. I don't know whether they're paying them enough. And I see so many kids coming out of the college system, social workers or people with degrees working in the area, but they're really looking for another job. They don't see integral care as being a place where they can build a career because I think they don't get enough money. I don't know if that's the case because I don't look at your organizational chart to see what the pay scale is, but could that be a problem? And what can we do to help them to keep people there that are the frontliners that deal with our population and that are, it's hard to get a handle on the population. It's hard to see that you're really making inroads if you don't have, if you're struggling to survive yourself as an employee. I just wanted to know what you think, whether that's an issue, whether I'm seeing it wrong, and what can be done to address that.
Well, certainly you're right, Manager Valdez, that our staff is overworked, underpaid. But just recently we gave them all a raise, all from the bottom to the top. They all got a raise. Our new CEO, Jeff Richardson, is a fantastic CEO. He hears what their concerns are. And we'll continue to try to fund increased funding, whether it be through private insurance, private people giving them money with galas, but you know, healthcare, brain health care has always been historically underfunded by our federal government and our state government. You're right in that we lose many great people to private industry, but we still have some great people there. We still have some remarkable people that work for us, and I think they'll continue to work for us as long as we can continue to support them financially. We did give them raises just recently. The good thing now is that they do have their own union, and that union is growing, and they are very vocal. And they come to our board meetings and do citizens comment with us, and they're going to support each other.
Maybe this would be a good time to see if Mr. McDonald would like to work with Integral Care.
Mike?
Oh, sorry. Maybe this would be a good time to consult with Mr. McDonald, who's on the other, Sendero board, to see if his AI, if he could find someone in the AI industry that could help remove some of the barriers to people actually being able to perform their job.
Sure. I mean, any help we can give our staff would be beneficial. They are overwhelmed with patients, but so anything AI could do for our staff, I'm sure that they would gladly appreciate it.
In light of the funding for integral care, are there any approaches the board could take to establishing, a set funding from trust or things like that would allow, without having the sinusoidal pattern of 1 year money and next year no money?
Yeah.
Has Integral Care explored those, with different entities that might be available to provide yearly funding at a set rate?
Most of our contracts come from the state and from grants and from the federal government. So I'm sure that
But I'm asking that in the private sector,
Sure.
is there anyone assigned to sort of maybe explore
Oh, yeah.
those avenues to?
Dr. Kathleen Casey is an incredible fundraiser, and she'll be out there, beating on doors, trying to get more funds for care, from private people.
Yeah, I would just ask if they could, I think that it's great to have the fundraisers, but I think to sort of find a way to have a steady stream, I'm not the Gates, but a similar kind of like a foundation says this is something we're committed to every year, that would allow for more pay raises, because this is an incredibly tight burnout job for most people, as we all know. So that's all. That's all my comments.
I will certainly pass that message on to Kathleen, and she's pretty remarkable.
Okay.
Very good.
Thank you. Any other questions? Is Manager May still there?
I'm still here. No
Any-
questions.
Okay, thank you.
Thank you.
Yes.
All right. Well, thank you so much for your service. Sincerely appreciated. Okay. All right.
Do you need a motion?
I do.
I'm sure Hal will tell you
Motion?
the same thing.
Oh, do you have a question?
No, I can do the motion.
Okay, do the
Okay.
motion.
I move that the committee recommend that the board approve the reappointment of Dr. Guadalupe Zamora to the Integral Care Board of
Do I have a
Directors.
second? Second by Manager Valadez. Any ayes?
Aye.
Nays? Okay, the motion,
I think I should abstain.
the vote is,
It still works too, so we have majority.
yeah, there we go. Okay, super. All right. Thank you so much. Pete, thank you for all your work, okay? Next agenda item is to announce a vacancy on the Sendero Health Plans Board of Directors and discuss the application and appointment process. He told us, who's leaving the board? Yeah, Benny.
Oh, Betty.
Yeah.
Betty Velardo.
So, this, last year I worked with, Chair Bell on this issue, and there's a set of there's a timeline here, to seek out nominees, okay? The needs from the board need to be identified, and we'll get we'll get the chair of the board to get input, as well as our central board managers, okay? It's all open for reading if y'all want to read it. Does this need to be read aloud? Okay, thank you. Okay. Once again, we did, after what had happened, we did establish a set of questions. So when we have a new nominee, that we can have a unified set of questions that don't diverge from that. So I won't be rigid about it, but I don't want things to meander all over the place. So, okay? Alrighty? There's no motion needed on this item. So next is to confirm the next regular.
Dr. Martin,
Yeah.
when we put that announcement out for a vacancy, and for future applicants to consider the service, do we put it on the internet? Do we put it in the newspapers? Are we putting it anywhere other than just our website? Who tells it? Who does that?
Let us know, but yes, it will be posted.
If they can expand that, maybe putting it also on since our board is supported by the city and the county, if they can put it on their networks and on their television stations also.
Yeah, and I would argue that, yes, the television's newspaper,
Yeah,
I mean, to run a little thing, not an ad, but
Just like a PSA.
Yeah, exactly, that there is an opening on the Sendero board, and
right.
I think it'd be informative. Because a lot of people don't know what we do. And it might be beneficial to get a media person to sort of go over that and, and then in conjunction with Mr. Garza and Pat, perhaps to discuss what they're looking for in a board member. So, okay, I think that's a good idea. Thank you, Cynthia. Okay, no motion is needed, so item 5, confirm the next regular ad hoc appointments committee meeting date, time, and location. Managers, we do not currently have a scheduled Central Health Ad Hoc Appointments Committee meeting. When a need for a meeting arises, we will work with the committee's members and other managers to choose a date and a time that works for everyone's schedule. At this time, I am ready to accept a motion for adjournment.
Move to adjourn.
Cynthia, and second by Manager
Second.
Brinson. Thank you. All right, we are adjourned. Thank you.
Thank you, Chair.
All right.
See y'all Wednesday.
Okay, see you.
Thank
Wednesday.
you.